If you're over 60 and starting to notice some changes down there, shrinkage, reduced sensation, or performance just not what it used to be, let's get one thing straight. You're not imagining it, and you're definitely not alone. What's more important is this: those changes might not just be about sex. In fact, they could be your body's quiet cry for help, a signal that something deeper and possibly more dangerous is going wrong under the surface. According to the Cleveland Clinic, certain subtle changes in sexual function in older men can often be the first clues to cardiovascular issues or hormonal imbalances. So here's the uncomfortable truth nobody wants to say out loud. Shrinking isn't just about ego, it's your body's urgent call for help. As men, we joke about it, ignore it, or chalk it up to just getting older. But here's why that thinking can lead you straight into a health crisis. The first big culprit behind these changes is a hormone called testosterone, no surprise there. But what may come as a surprise is that a decline in this vital hormone isn't just an unavoidable part of aging. According to Harvard Health, many of the symptoms men think they have to just live with can actually be reversed or managed when testosterone is optimized. This includes energy levels, muscle mass, and yes, penile size and function. Low testosterone can make your tissues thinner, less elastic, and less sensitive. You may lose not only firmness, but also actual length or girth. And that's not where it stops. It could also signal early onset erectile dysfunction, an enlarged prostate, restricted blood flow, which, by the way, is one of the earliest red flags for developing heart disease. You see, the arteries in the penis are much smaller than the ones leading to your heart. So when they start to clog up, guess where you feel it first? Ignoring these signs can have real consequences. We're talking about accelerated aging, loss of vitality, and missing an early chance to catch something as serious as prostate cancer. In some cases, size and sensation diminish not because of just getting older, but due to persistent inflammation, blocked arteries, or hormone imbalances, things well within your control. Now, coming up, I'll show you the one mineral older men are commonly deficient in that plays a huge role in blood flow and sensitivity. Plus, a simple 7-minute daily habit backed by science that can naturally raise your testosterone over time. But let's start where it all begins. Blood flow. It may not be the most glamorous topic, but when it comes to maintaining size and function, blood flow is king. Think of your penis like a muscle. It needs oxygen, nutrients, and good circulation to stay healthy. When blood flow slows down, oxygen delivery drops, tissues atrophy, and yes, you may notice a visible reduction in size over time. In fact, the Mayo Clinic points out that poor circulation doesn't just affect energy and heart function, it directly impacts the health of your sexual organs. So, what fuels proper blood flow? One key player is nitric oxide, a molecule that helps your blood vessels relax and widen. Certain foods can boost nitric oxide production naturally. Beets are a power food in this area. So is watermelon. It contains an amino acid called citrulline, which the body converts into nitric oxide. Add in leafy greens like spinach and arugula, and you've got a daily plate that supports blood flow in all the right places. If you take away just one thing here, fix your flow, and everything else improves. But blood flow doesn't work alone. Let's talk testosterone again, because it's not just about drive or libido. Testosterone plays a central role in maintaining tissue strength, muscle tone, and even contributing to blood vessel health. After the age of 60, testosterone levels tend to drop by about 1% each year. But if you're sedentary, under chronic stress, or eating a poor diet, that decline speeds up, and so do the symptoms. Low testosterone leads to thinner tissues, weaker erections, unwanted fat buildup, and yes, shrinkage. But the good news? Certain key nutrients can help. Zinc is essential. Studies show it helps support natural testosterone production. Vitamin D is also crucial, especially if you live in a climate with long winters or don't get much sun exposure. Then there's boron, a lesser-known mineral that's been shown to boost free testosterone, the active form your body actually uses. And remember that overlooked mineral I teased earlier? It's magnesium, and over 60% of adults over the age of 60 aren't getting enough. Magnesium supports everything from testosterone balance to reducing muscle tension and enhancing sleep, all vital for daily recovery and hormonal health. Now here's where a lot of guys get blindsided. The pelvic floor. Ever heard of it? Most men haven't. But just like women, men have a group of muscles in the pelvic area that support the bladder, the prostate, and yes, erectile function. When those muscles weaken, you lose foundational support. Erections may not be as strong, control over urination may suffer, and even the appearance of your anatomy can change. We call it the pelvic sinkhole problem, where everything slowly starts to collapse inward due to lack of support. But here's the fix. Kegels. That's right, pelvic floor exercises aren't just for women after childbirth. Men can benefit from them just as much, if not more, as we age. It's simple. Tighten the muscles you'd use to stop yourself from passing gas or holding an urine squeeze. Hold for 5 seconds and release. Do that 10 times, 3 times a day. You can do it reading the newspaper, sitting at a stoplight, even while watching TV. No one will know, but your body sure will. Not only can this help keep everything firm and functioning, but it also contributes to better bladder control and potentially stronger orgasms. Yes, seriously. Okay, are you still with me? Because what I'm about to say next may be hard to hear, but it's critically important. Stress is silently sabotaging your body. Chronic stress increases cortisol levels, and cortisol does 2 very damaging things for a man over 60. First, it constricts blood vessels, reducing blood flow down there. Second, it tells your brain to slow down testosterone production. According to Harvard's neuroscience research, ongoing stress disrupts what's known as the HPA axis, the system that controls all your hormones, including testosterone. So what can you do? Start by reclaiming 7 minutes a day, just 7. Practice what's called box breathing. Inhale for 4 seconds, hold for 4, exhale for 4, hold for 4. Repeat for several minutes. This simple practice has been used by Navy SEALs and is now recommended in clinical psychology for stress regulation. If that's not your style, even a brisk walk outdoors in the morning sunlight plus motion can recalibrate your stress response dramatically. And don't underestimate the damage of sitting too much. The average older adult can sit more than 9 hours a day, but the problem is when you're sitting, especially on a soft surface, you may be compressing arteries and nerves connected to the pelvis. Over time, this reduces blood flow and suppresses testosterone. Try this. For every hour you sit, stand or stretch for just 1 to 2 minutes. Even better, knock out 5 bodyweight squats every hour. That's it. You'll wake up the lower body muscles responsible for pumping blood and remind your system to keep things circulating where they matter most. Want to see what this looks like in real life? David is 67. A few years ago, he started noticing things down there looked different. He measured, yes, some men do, and noticed an inch lost in length over 2 years. He brushed it off until he started having trouble urinating. That's when he finally saw his doctor. The result? Early stage prostate enlargement, but thankfully caught just in time. With some lifestyle shifts, he turned things around. But that slow shrinkage? It was the earlier warning sign. Or take the university study out of Boston that looked at men over 60 with metabolic syndrome, a common combination of high belly fat, blood pressure, and insulin resistance. The men reported more erectile issues and noticeable shrinkage. Yet, after just 12 weeks of resistance training, cutting sugar, and adding blood flow foods like berries and beets, their function and confidence bounced back. And then there's Tom, a subscriber just like you. He added a few simple changes: daily pelvic floor exercises, a nitrate-rich smoothie with beets, and a supplement with L-arginine. Within 6 weeks, he noticed firmer, more consistent performance. But more than that, he felt more energized. His confidence returned, and so did his morning routine, if you know what I mean. What do these stories have in common? They all started by listening to their bodies and then doing something about it. So if you've noticed changes, don't settle. Don't ignore them. This isn't about vanity, it's about vitality. And there's so much you can do starting today. The uncomfortable truth is this: changes in sexual function after 60, whether it's shrinking, less sensation, or weaker performance, aren't just a fact of life. They're often early warning signs from your body. But if you act now, you can not only stop the decline, you can actually reverse some of the damage. Let's shift gears now and talk about sleep, because this is the foundation most men underestimate. According to the Mayo Clinic, poor sleep not only robs you of energy, it lowers testosterone, weakens blood circulation, and increases inflammation. That's a triple hit to your sexual health. You might not feel it instantly, but over time, it takes a serious toll. Think about it. How many nights a week do you get fewer than 6 hours? Be honest. When your body doesn't sleep deeply, especially the REM stages, your testosterone production tanks. It's during sleep that your body repairs tissue, balances hormones, and clears away the stress chemicals that mess with your heart, your mind, and yes, your sexual health. Now here's a practical tip. Make your bedroom a hormone-boosting haven. Cool the room to 65 degrees. Keep it dark, I mean pitch black, and shut down screens at least 60 minutes before bed. Blue light from phones and TVs confuses your brain and suppresses melatonin, a hormone that supports both sleep and testosterone. Need help getting to sleep faster? Magnesium can work wonders. It helps relax your nerves, reduce nighttime cramps, and support deeper, more restorative rest. Try a magnesium glycinate supplement before bed or soak in an Epsom salt bath for a natural alternative. Here's a rehook for you. Imagine waking up not groggy, not stiff, but with energy, motivation, and yes, that familiar morning signal that things are working again. Let's build on that momentum. What you eat first thing in the morning sets the tone for your hormones for the whole day. So skip the sugary cereal or bagel those spike insulin, crash your energy, and worsen belly fat. Instead, fuel with testosterone-supportive foods, eggs, greens, avocado, nuts, and maybe a handful of blueberries. Want a sample power breakfast? Try this. 2 whole eggs scrambled in olive oil, 1/2 avocado, sliced on the side, a cup of spinach sautéed in garlic, and a few walnuts or almonds. This combo gives healthy fats, energizing protein, and nutrients like boron, magnesium, and vitamin E, all of which support circulation, testosterone, and cell recovery. Now, somewhere around this point, a lot of men ask, should I take testosterone supplements? And it's a valid question. But here's the deal. Before jumping to medication, it's important to get your levels tested. According to Harvard Health, testosterone replacement therapy, or TRT, can help in certain cases, but it also carries risks if misused. It can suppress your natural production or increase blood clot risks if not properly monitored. The smarter approach? Start by supporting your body's own production with lifestyle strategies. First, nutrients, strength training, stress reduction, better sleep, and retest in 3 to 6 months. You'd be surprised how effective these changes can be when done consistently. Let's rehook again here. Are you starting to see a theme? Small, daily habits done right can lead to big improvements. So let's look in another one, regular, strength-based movement. The Cleveland Clinic recommends weight-bearing exercise for older men specifically because it boosts testosterone naturally. Think things like squats, push-ups against the wall, light dumbbell curls, even water resistance training if you've got joint pain. The goal here isn't to look like a bodybuilder. It's to stimulate your muscles and endocrine system so they stay active. You don't have to hit the gym for an hour. Try a 5-move circuit right at home. 1. 10 air squats. 2. 10 push-ups on the counter or against the wall. 3. March in place for 30 seconds. 4. 10 bend over rows. Use soup cans if you don't have weights. 5. 10 standing calf raises cycle through 2-3 rounds. You'll be boosting blood flow, increasing nitric oxide, building muscle support around your pelvis, and yes, encouraging more natural testosterone. Now, here's something personal. My own father went through something like this in his early 60s. After retiring, he stopped moving as much, gained 15 pounds, and complained things weren't the same downstairs. He avoided the doctor, laughed it off. But it wasn't funny to him when confidence plummeted, when energy started to fade, when my mom noticed he was less engaged in day-to-day life. With a little gentle nudging, okay, maybe more than a little, he added in pelvic floor exercises, started walking 20 minutes a day, added a beets and spinach smoothie every morning, and prioritized sleep. Within 4 months, he looked better, felt younger, and yes, mornings made a comeback. It's never just about one thing. It's blood flow, it's hormones, it's strength, it's stress, it's the food you eat and the sleep you get. If even one of these is off for too long, problems show up sometimes in the most vulnerable places. But you are not powerless, and you are not too far gone. Let's bring this all home. Prioritize blood flow with nitric oxide-rich foods like beets, watermelon, and leafy greens. Support testosterone with nutrients like zinc, vitamin D, boron, and magnesium. Strengthen your pelvic floor with daily Kegels, 3 sets of 10 every day, no excuses. Move your body consistently, even just 5 minutes an hour or a daily walk. Optimize your sleep with a cool, dark room and an evening wind-down routine. And manage your stress with daily practices like like deep breathing or mindful outdoor movement. And if you're curious about how to bundle some of these strategies into one easy morning routine, make sure you don't miss our next video where I share the exact 10-minute wake-up protocol that's helped hundreds of men turn things around. Remember, shrinking and loss of sensation isn't the end. It's a message. And now that you know what it means, what will you do with that knowledge? If this video helped you, please hit that like button. It lets YouTube know you value this kind of content. Subscribe if you haven't yet. We talk openly here about the things most men suffer from silently. And be sure to check out the video I've linked right here. What 10 minutes each morning can do for your testosterone. It's simple, actionable, and could start changing the way you feel this week. This isn't just about performance. It's about freedom, vitality, and owning your health because that's what you deserve. You've still got a lot of life ahead of you. Make it strong, make it confident, and make it count.